Goodbye, 2023. Adios. It's time to welcome the new year ahead. For many of us, each new year signals an opportunity for a fresh start. As you set your intentions for 2024, it's important to keep in mind every new beginning begins with an end. Are there some habits you need to let go of to make room for new, healthier habits? Is it time for a well-being makeover? And if so, what would that look like to you? Welcome to UT Health San Antonio Wellbeing Wisdom Podcast, a dose of learning for healthier, happier lives, brought to you by the Office of Human Resources. I am your host, Laura Gottlieb, and our topic today is New Year, New You, Wellbeing Makeover for 2024. We are joined today by our very special guest, UT Health San Antonio faculty member, licensed professional counselor, supervisor, and clinical director in the Department of Psychiatry and Behavioral Sciences, Division of Community Recovery, Research and Training, Megan Frederick. Welcome, Megan. We are beyond delighted you're here to share your well-being wisdom on this important and timely topic. To kick things off, I'm wondering if you could start by telling us a little about yourself and your professional journey, along with your genuine passion for ensuring everyone has access to mental health and well-being support.
Hi, Laura. Thank you for this question. And thinking about what you just asked, it really is so true that it's a passion. Thinking about sort of my journey and how I got where I am today and doing the work that I do, it's been the better part of my life, actually. It truly has been that. Starting way back as an undergraduate student, I was doing volunteer work, convinced I would work in primary education in some capacity. I did volunteer work doing respite care with kids with serious physical or emotional disabilities. And it was a great eye-opening opportunity and experience to really see not only what it's like to be that child, but the struggles and challenges with their caregivers and all that they have to go through and sacrifice in their lives, and really sometimes how little support or access there is. And this was in a different state and a different time. I was an undergraduate in Wisconsin and then did some work in a social work program at a tier 1 school with many refugee children, where we were seeing kiddos that didn't have food. They didn't have coats in the Wisconsin winter. They didn't have access to the basic resources that we all truly need to thrive. So I think this passion just kind of brewed as a really young adult in my formative years of education. And then when I decided to go the route of community mental health counseling, I had the opportunity to work with adults with serious mental illnesses, people who had been in the state hospitals and had true clinical symptomatology and diagnoses that were underserved, that did not have access to the care they needed. And so that became a strong area of focus for me for the first half of my career. Once I moved to San Antonio, I had the great opportunity to become a research assistant in the Department of Psychiatry, working with individuals with schizophrenia and related disorders of psychosis, and continued to see, again, in another state, in another city, this is a global problem, really, that people don't have access to the care they need. There weren't treatments available. So that, again, just kind of instilled that further passion, became a greater interest in developing over the last decade programming for people who need access to care and their families and caregivers, people who need services, who don't have insight or the ability to navigate the really complicated system that we have here in the United States, period. It doesn't really seem to matter so much where you live. And Texas tends to struggle more than other places, really. But then most enlightening, really, has been the last few years since the COVID-19 pandemic. I feel like the early part of my career really looking at treatment and access to care for serious mental illness and their family members. Now here we are in the middle of a pandemic where we saw people's overall sense of well-being at its lowest point. People were struggling with anxiety and depression, and there was loneliness and socioeconomic stress and stress about school performance and the future of our youth, and all of these things that really came to the forefront. None of us were immune. Nobody was immune during the pandemic. We were all navigating this together, and it really shed light on the absolute importance for all people to have the opportunity to have a peace of mind, to manage stress, to have a quality of life and a sense of well-being. And so as a result, we were able to partner with the community and develop a program really geared toward access to care for all. So access to care without need for a specialty referral, access to care without having a known history of a diagnosis. People can now receive services through our new Opportunities for Wellness clinic to get support, come to skills groups, work with a peer, receive counseling or therapy for any number of things. And that's kind of where we are today, is this new focus on truly the whole spectrum in people's lives and what it means to have wellness and well-being.
Thank you, Megan. I really appreciate you bringing up the pandemic, because it was something we all collectively experienced, and it put pressure on the system, and the system being even our own families. And we saw cracks and fissures and pressures and challenges with mental health. So thank you for sharing that and your professional journey. And my hat's off to you for enduring the cold Wisconsin winters. Yeah, I'm curious. The word well-being is almost a buzzword. In fact, the U.S. Surgeon General in 2022 came out with a plan to address mental health and well-being in the workplace. We saw research from Gallup saying that stress is at an all-time high in the workplace. And, so we're hearing a lot about well-being programs, even wellness programs. And so I'd love to hear from you. What do we mean when we talk about well-being? And is there a distinction to be made between well-being and wellness? And a lot of these programs we've been starting to hear more and more about.
I think you make a really good point, Laura, about the buzz, right? The buzz making it seem almost as if it's like a pop culture phenomenon. People are talking about well-being, and they talk about, having boundaries more. And we hear people talking about prioritizing time and balance and things in a way that we never really had seen as a society, honestly, again, prior to the pandemic. And maybe that's okay. It was like the pandemic gave the concept of well-being its moment. It gave personal wellness or behavioral health care its moment. And as a result, it really has been something that I think employers and culture, society has been forced to talk about, kind of distinguishing between wellness and well-being. They aren't exactly the same, though they're used interchangeably quite often. When we really look at a true, Oxford Dictionary definition, well-being is actually a state of being. It's a state of being comfortable, healthy, and happy. It's about a general state. Wellness, in contrast, is really the pursuit of that. Wellness is things that we do, as in actions and lifestyle choices, to get to an established sense of well-being. So wellness is more so the action, the decisions we're making in our lives to have a state of well-being, if that makes sense.
It makes a lot of sense. And I really appreciate how you connected where we are in this journey with what came out of the pandemic. And one of my favorite expressions, childhood expressions from my dad growing up, was out of the mud, a lotus grows. So we saw the pandemic as being this, really awful thing we all had to deal with. And yet there were many good outcomes from it, more attention to public health and wellness and well-being and all of that. So I appreciate you connecting those dots for us. I'm wondering, what are some important dimensions of well-being for us to pay attention to?
When we think about well-being, it isn't the same for all people. I think that's a really crucial point. It isn't the same for all of us. It doesn't have to look the same for all of us. And it really comes down to what matters most in your life, or what areas we'd like to see the most improvement in our own lives. But dimensions of well-being are varied across sort of all facets of human existence, really. So going through kind of the most common ones there, as I've spoken about a lot, because this is what I do every day, is emotional and mental well-being. I'm managing emotions, coping with challenges that arise, applying skills in a way that involves intentionally kind of creating space for reducing resilience, reducing stress, doing things that bring joy, engaging in daily practices of gratitude and mindfulness. And when it comes down to it, if you're really going through something, not being afraid to make the step to schedule an appointment, talk to a professional, especially when you feel the most maxed out on your own ability to manage stressors. We all have limits. So that's emotional and mental health well-being as being something that's a primary concern and interest. Then we also have physical well-being. So physical well-being, including things we think of automatically. So diet and exercise, increasing what we intake for water, choosing the right foods. It's so easy to choose snacks. They're everywhere we go, but choosing brain healthy foods, looking at alcohol consumption and reducing alcohol consumption, making appointments, things that we sometimes, I think, back burner under a stressed scenario or stressed society. We don't necessarily make preventative wellness checkup appointments, or we don't follow up on existing health conditions that we've been, meeting with a provider about in the past. And rest, we, I think, underestimate as a society, probably worse, truly, and in research shows this in the US than other places, the emphasis on rest and lack of sleep being a true key driver in overall well-being, and getting fresh air daily. So spending time outdoors, it's good all around. And so prioritizing those things, making those things something that we focus on. So in addition to kind of the mental and physical health components, then there's spiritual well-being. So looking at your sense of purpose, or finding a sense of purpose and meaning in life, making time to do some self-reflection, some alone time, establishing sort of your clear personal sense of moral ethics and standards, ways in which you aim to live. I think that we have, lots of people's opinions and views of sort of the world or cultural relationships coming at us from different angles, probably more than ever in history. And so kind of taking a stand on where we lie on some of these concepts and issues is really important. Then there's social well-being. So that, involves maintaining relationships with people in our lives that are authentic, relationships that are meaningful, establishing a sense of community. I hear from people all the time how hard it is, for example, to make friends as an adult, particularly if you're living in an area where you didn't grow up. So finding a way to get connected in your community, find an organization or a volunteer program, something to participate in with other people. Be intentional about socializing with neighbors or finding time to say hello to peers or colleagues, establishing kind of ongoing relationships and check-ins with mentors or supervisors, and of course, family and friends, and old and new. Then another dimension is occupational. So occupational well-being, looking at our personal satisfaction and the meaning that we find in the work that we do. What does our work contribute to? Kind of identifying that for ourselves and setting, stretch goals, working toward things that you think will help improve your quality of life or improve your sense of overall satisfaction and well-being. And along the way, looking at that balance. How do we find balance between work and personal life? Finding a career that will allow that, or setting our own limits, again, setting our limits for what you can give to work within reason, because there are expectations everywhere, and what you need to give to your personal life, and being all in when you're doing those things, and focus on your strengths. I think sometimes people get in a situation where they have to do jobs that pay bills, and that happens a lot. But really giving time to focus on your strengths, where your strengths are, your areas of interest, honing in on those and learning how to apply them is a really huge key to having occupational well-being. And kind of related, right, is financial well-being. So how do we plan and manage finances? Do you have a budget? Do you remain in control and feeling secure with your finances? That's one of the biggest stressors in America, of course. People's least favorite thing to do is public speak. And one of their biggest stressors is managing finances. And so learning how to do that in a way that brings financial freedom is a way to work toward well-being, or is well-being. I'm sorry, that would be wellness in action, actually. Societal environmental is another facet of well-being. So looking at quality of life and sort of being in a community that you feel like harmony with as a person. We all have different interests. We all have different views. We all have different sense of meaning and purpose and value, and finding a way to be harmonious in your community within that, right? And so again, it's more about self-identity and exploration. Consider engaging in some kind of an effort that is important to your community, some kind of conservation or preservation. Again, that might look like volunteer work. It might look like joining a group or being on a committee near your home, in your neighborhood, that is socially and environmentally friendly. And then intellectual well-being. I think that's something that maybe we don't talk about as much, or it's not as obvious. And a lot of these overlap. A lot of these, once you really start to look at one area, you see how it's connected to another facet or dimension. But you might have the most success targeting them individually at first. So intellectual well-being, finding things that enhance your knowledge, finding ways to learn new things, develop skills. I was talking to a neighbor the other day, and she said if she weren't a medical professional, she would become a YouTube trained handywoman. So developing kind of interests and growing skills and learning how to do DIY projects and embrace learning. There's never really a limit on what we can learn, how we can teach ourselves or be taught new things, seek out professional growth, have hard conversations if it comes down to it. Establish hobbies that are stimulating and meaningful, or join a cause, once again, that creates interests that are new. So again, looking at all of these dimensions, 8 of them in total, but how they overlap and how they bring different meaning to your life in the new year.
Megan, so many golden nuggets here. Honestly, this has been amazing. So a couple of things that really stood out, this idea of normalizing that we all have limits. And, in fact, a real show of strength is asking for help. So I really love how you highlighted that right from the beginning. And then also no limit to learning. This is a lifelong journey, and there's so much we can do and be. And, going back to even the definition of well-being, it's about being. And
Right.
so I really
That's right.
appreciate everything you shared on that. What are some steps we can take to make a positive, sustainable well-being change, or even a complete well-being makeover? That sounds so daunting. And, kind of piggybacking on that, and a tough part for many of us, what steps can we take to prioritize our well-being? So that's a complex question. I'll let you start wherever you want to with that. So again, steps we can take to make positive, sustainable well-being changes, and then how do we prioritize our well-being?
That is a loaded question. But again, an important one, right? So there are a lot of different ways, not a one size fits all scenario here. And again, becoming really familiar with ourselves and doing some true kind of soul searching, some reflection, that might be the first place to start for all of us, is identifying places that we see need for change, or we'd like to see some growth, or conversely, where we find that there might be a deficit, or we're lacking in some way. that's where we identify areas to sort of make over. Um, always the hardest part is taking the first step and then maintaining that step, right? So it kind of comes down to being intentional, committing yourself to a plan, put it in writing, but make it small. If we tackle everything at one time, we unfortunately, I think, set ourselves up for failure versus success. So be intentional, but start small. Don't try to hit all 8 of those domains. That would feel extremely overwhelming. Do little things that make a small difference. Small habits stack to make big habit changes and big differences, right? And so, there's like culture thinking that we can do something new and make a change in 21 days. I mean, I feel like I hear that thrown around all the time. And that's ideal if it were possible. But really, it probably takes a lot longer than that. A lot of research shows that it's really more like 60 days or even up to 80 days to truly make a new habit stick. And so it doesn't come without having a little bit of grit, some wherewithal. We have to make small changes, but do them daily, do them routinely. And a really huge way to make this effective and make new changes stick is to do it with someone. Don't do it alone. Identify a change partner. Maybe it's a spouse, maybe it's a colleague, maybe it's a neighbor, and you decide to go walking together 5 days a week. Something that commits you to doing it with accountability is a really important process or step in the process. Um, then we kind of look at what comes first, right? If we don't make a starting point, we never get it off the ground, I guess. So it's write it down, own it, set reminders, things that give us sort of a prompt and a place to start. If we just have to come with sort of internal motivation, while that's ideal, we all wish we could do that, life gets in the way. So how do we use the resources we have at our fingertips? Again, I mean, we have apps, we have phones, we have devices, we have watches, we have all kinds of things. So use those and really put them to practice. That's a place and a way to prioritize and get started.
I just want to highlight how you mentioned that taking the first step and maintaining it tends to be the hardest part. And so, what I heard come up was this idea of self compassion, uh, having some gentleness with yourself during the process and giving yourself maybe more time than the popular notion of a 21-day turnaround. It could take more than 60 days if we have little setbacks along the way, and being patient with ourselves. And then this idea of having an accountability partner and accountability by writing down the commitments we're making to ourselves and the intentions that we have. So all of that really incredibly motivating and also empowering, I think, for people who are wanting to make some changes in the new year. I'm wondering, what are some of the benefits of prioritizing our well-being and taking care of ourselves first, so to speak? What are some of those benefits?
Again, that's a great question. I mean, we all get on an airplane and they say, put your mask on first before you help others, right? And so we know that that's been ingrained in us, but do we live by it? Do we really practice that? And what does that mean? I think that's what is loaded into this question here. And we kind of get in this situation as humans currently in our extremely fast-paced, high-demand society where it seems like we're not doing anything if we're not operating at least moderately burnt out. That's sort of become an old-fashioned way of thinking, if you will, though it certainly serves its place. It makes people feel like they're getting a lot done and being productive. But actually, a lot of evidence suggests that that's just not true. Multitasking, overcommitting, operating on empty is actually less productive. We are learning that we cannot do as much as we'd like. We cannot accomplish as much if we aren't in a good space to do that. So some of that means just creating time. It means doing simple things. Again, small steps. Set your alarm 10 minutes earlier, 15 minutes earlier. This year, I've actually already seen in 2024 a lot of sort of social media and public talk about a movement toward the 5 a.m. club. People are intentionally getting up at 5 a.m. daily, giving themselves an entire hour to wake up, to start their day, maybe engage in spirituality, engage in exercise, do just quiet personal reading, things that will start your day on the right foot. So, again, that's a wellness action toward a state of well being. Using calendars, creating space to take care of yourself, scheduling breaks, put walks on your calendar if it means you make the time to do it. If we don't take care of ourselves, if we aren't drinking enough water, if we aren't sleeping enough, then it's sort of the old adage, garbage in, garbage out, right? If we don't feed ourselves, we don't produce well. So what you put in is what you give out, and what you sort of give out to your family, to your job, to the universe. We end up being more productive. We have improved relationships, we have improved work experiences, and we naturally then develop an increased sense of balance or control. And again, you used the word a little bit ago, empowerment, right? We feel a little more empowered in our lives.
It sounds like blocking time and some of the practices that you mentioned are keystone habits for making long-term sustainable change. Thank you for that. Wondering how can resources, like the new opportunities for wellness and transitional care clinics help along with our UT employee assistance program? Who's eligible for these kinds of resources?
As you share, I mean, just listing those things, we have so much available to us as a community. Certainly, San Antonio has made great strides overall over the last 15 years that I've been working in the area, as far as access to behavioral health and mental health services or support services. And what a blessing, right, from the institution that we have such a robust EAP and we have additional resources through our benefits package. So, speaking really specifically about the new opportunities for wellness, or UT Health Now Clinic and the Transitional Care Clinic, and we have a faculty wellness service as well. These are clinic-based programs that are available to our community. So the Now Clinic, as I briefly mentioned earlier in this discussion, is our self-referral community-based program. This is for all of us. This is for you and me and our neighbors and our friends and our family, to receive care when they need it, how they need it. So we offer telehealth services. We offer in-person services. We have a few evening appointments. We have counseling. We have support groups. We have skills groups. We work with things such as grief and loss or anxiety and depression. We have a mindfulness-based stress management group that is available late in the day, kind of geared toward working adults. I think it's at 4 p.m. So we are trying to target services that are available to people at a time that makes sense and in a way that makes sense. Therapy, psychiatry services, again, skills groups, peer support. And that's through the lifespan. So one thing that's been, again, a tremendous outcome of the last 4 years is that we've had the ability to expand services across the lifespan, from child all the way through geriatric psychiatry is available. And that's, again, through outpatient services at UT Health, self-referred. You don't need a private referral, and you actually don't even need insurance, which is pretty beautiful. And that's a great fortune of having good community relationships and partnerships and funding support from community partners and at the state level. The TCC is for individuals in our community, kind of back to the roots of the work that I was doing and my colleagues, was to treat individuals with true kind of ongoing mental health concerns or crises even. And so people that were recently treated in an inpatient facility or visited an emergency department because they were really at their lowest, they were doing pretty poorly. The TCC is available for referral from the hospitals. So people that have been at any facility in town, their loved ones could advocate to get a referral to the TCC, and then they become established with UT Health Services. And then we have our faculty wellness as well, that's new this year, where we are offering services to faculty members in a dedicated way, knowing the challenges with scheduling and the challenges with, access to care in a way that makes sense to them. And then, again, UT Health EAP. The EAP covers so much more than people necessarily realize. There's legal advice, there's financial advice, there's all kinds of support that is covered by our EAP. It never hurts to make a phone call and ask questions and see what the EAP resources can do for you. That's available, of course, on the Human Resources website, but ask your supervisors if people are wondering. See how to get connected with EAP. And additional benefits as well, right? So again, personal, whole person well-being. We have the access to gym memberships and online weight loss programs and diet and exercise programs. So there's so much at our fingertips. Once again, kind of relating back to taking the first step, knowing how to access these resources, knowing where to find this stuff so that you can make actionable change.
Thank you, Megan. As you heard from our expert guest today, overall well-being includes a number of dimensions worth paying attention to, and it's up to each and every one of us to prioritize our own well-being. The cascade of benefits for doing so are exponential. As we take better care of ourselves, we're in a much better position to care for others. Megan Frederick, thank you for being our expert guest today and making lives better by sharing your well-being wisdom. Tune in next time for our special May podcast on mindfulness in the age of distraction.